WARR 1520 AM in Warrenton, North Carolina, where the community comes together. Good morning. We are proud to have in studio this morning a couple of just awesome people. They've been with us on several occasions, sort of keeping us updated. One with what's going on in Warren County, and the other with what's going on as far as our health is concerned here in Warren County. I'm talking about none other than our very own county manager, Mr. Vincent Jones, and Dr. Margaret Brake. I hope I have this correct. Warren County Health Director. Okay, all right, you're right. So we're going to say good morning. We were talking off air a few minutes ago, and our very own county manager is going to kick things off, and we're going to just go from there. Good morning. How you doing?
Hey, good morning, Reverend Galloway. How you doing this morning?
Hey, so glad to have you back. You know, Dr. Darensberg and I, we were talking about you guys when we would get back with you, because I think one of the times that you were with us was when at the beginning of this coronavirus, COVID-19. So we're very happy to have you back in the studio, reading a lot of stuff concerning COVID-19 here in Warren County, hearing a lot of stuff here concerning COVID-19 here in Warren County. But I'm so glad that we have the people who sort of have their finger on exactly what's going on. So,
well, thank you, sir. We appreciate you all, you and Dr. Darensberg, having us back this morning. It really has been a tremendous help for us to get the word out to our residents on what actions we should be taking to keep each other safe here in Warren County. So this morning we thought it would be a great time to come back and talk to you all, because if you're keeping up with what's happening in the news, you will see that North Carolina has been identified as one of those states where we're seeing an increase in COVID-19 cases, whether it's because of increased testing, but more people are exposing or getting exposed to the virus. And so we're seeing that here in Warren County. And so we just want to encourage our residents to continue to try to keep each other safe. And Dr. Brake will give us an update this morning, but we have to do those things that is going to help us keep each other safe, practicing social distancing, washing your hands, and last but not least, wearing face coverings. So we need to make sure that we are just talking and having a discussion with the community so they can realize the importance of doing those things.
So good. Good morning, Dr. Brake.
Good morning.
It's glad to have you here as
Thank
well,
you.
and I know you bring a wealth of information with you concerning this COVID-19. So,
Okay, great. So just wanted to start off this morning just giving you all an update on our case counts as it relates to COVID-19. So as of yesterday afternoon, we had 144 confirmed cases, positive cases in Warren County of COVID-19. We're excited to say that 104 of those cases are considered recovered. So we're very happy about that. So what that means is the majority of people who have contracted the virus are able to stay home, they recover from home, are not hospitalized. And so that is very good news for our county. We currently have one hospitalized case, and unfortunately we have 4 people who have passed away due to COVID-19. And so with that, I do extend our condolences to those families that have been affected, and just let them know that we are thinking about them during this time. I do want to say that all of our cases pretty much are spread across the county. We do have a range of people who have contracted the virus, so I just want to say that the virus does not discriminate.
right.
We have positive cases among all of our racial ethnic groups pretty much in the county. And the ages range from 2 years old, which is our youngest case, all the way up to 92 years old. So we do know that it is, as I said, indiscriminate. We have many different folks who have been affected. We also know that some of us who contract the virus may show symptoms while others do not. So in that instance, as Mr. Jones says, we need to continue with prevention strategies because we don't know who has the virus. And so in this instance, we need to treat everyone as if they may have been in contact with someone. So I do want to first thank everybody who continue to practice the public health strategies that Mr. Jones mentioned. We need to do these things to keep ourselves and our loved ones safe. So those strategies, again, we call them the 3 W's, are first to wear a cloth face covering. We know that this is critically important in preventing us from spreading the virus to other people. And so I talk to young adults and young people a lot about this because many of them think they are not affected by COVID-19. And so the data is showing us that everyone is affected by it. And so while the virus affects people differently, some people get it, they don't have symptoms, or if they have symptoms, they're very mild. Others who get them have critical health conditions and have to be hospitalized. So wearing your mask helps protect other people from getting the virus if you are exposed to it. And so when I talk to young people, that's what I try to tell them, because they tend to be the ones that are more healthier, have less health problems. But if they do have the virus, they are capable of transmitting it to their grandmother, to their parents, to their sick cousin who has diabetes or some other health condition. So we want to make sure that we protect our loved ones, but also vulnerable populations and those of us who are essential workers. So we do have people who have, in spite of what's happening with the virus, come to work every day. Those are the people who serve us through EMS, our law enforcement, all of our healthcare workers, and even those individuals who provide services to us. So restaurants, the folks who work at Food Line and other grocery stores, all of those people are essential, and they have come to work every day to provide those services. So wearing a mask actually helps us protect them as well. So that's the first one. The second one, Mr. Jones mentioned, is social distancing. And that is where we're waiting 6 feet apart from other individuals to avoid close contact. So we see this most frequently when we go into our retail outlets and they have the floors marked with X's, or they have signs that tell you to wait here. And then when the first person in front of you pays for their items, then you can step up. So that's called social distancing, and that is waiting 6 feet apart. And the purpose of that, of course, is to prevent people from having close contact with other folks. And then the third one is just washing your hands frequently. So the CDC guidelines suggest that we wash our hands for at least 20 seconds. And if we don't hand wash, if we are not able to hand wash, that we use a hand sanitizer. So those are the 3 prevention strategies that we have been promoting and talking to our community about. It is important that we do all 3 because a combination of those will help best protect us from spreading the virus. So those are the 3 strategies. And I did also just want to mention, I think the last time we were here, we talked primarily in terms of symptoms of having a fever or chills, a cough, or shortness of breath. And I think even since the last time we were here, at that time, the symptoms had been expanded by the CDC. And so even today, we are seeing that the number of symptoms for COVID-19 is increasing. So in addition to those, we have fatigue as a symptom, having muscle pain. And if you notice, a lot of these are similar symptoms to the flu. So we just need people to be aware. Muscle or body aches, headaches, sore throat, congestion or runny nose, nausea or vomiting. We're also seeing that people have diarrhea, and they have a new loss of taste or smell. So all of these are symptoms, and while they seem very much related to other respiratory illnesses, they are also symptoms of COVID-19. So what we're seeing as we're monitoring cases in Warren County is that people are having a variety of symptoms. Okay, so a lot of our residents that we're monitoring have experienced the taste of loss or smell. Sometimes that is their only symptom. Okay, and then we have other individuals who have headaches, or they have symptoms that they really consider just a common head cold. Like this is a common head cold, or if they have allergies, symptoms of allergy, the runny nose, those types of things. So the symptoms are wide range, they're varying, and I would also say that there may be other symptoms that we are not aware of. So the CDC is constantly monitoring that and looking at data that we're collecting as local health departments of what our residents are experiencing in terms of symptoms. So
you guys did a free testing a couple of weeks ago, did a testing.
Yes,
several weeks
Dr.
ago.
Russell of Hope Regional Medical Clinic
Okay.
hosted a drive-through testing on June the 6th of this month, which was very successful. So we do appreciate her bringing that to our
Do you
community.
see that coming back again?
Well, she has indicated that she would like to do that again, and so we hope that we will be able to do more drive-through testing. As we learn more about the virus, I think the state is changing the guidelines. We have new provider guidance that comes out almost every week or so. So those types of things are changing, and the criteria for how people can be tested is also changing. So we look forward to more opportunities to bring those types of events to Warren County where people can be tested. But right now, if a person is experiencing symptoms, or if they have been in contact or think they may have been in contact with someone who is a positive case, then they can call their primary care doctor. And I would say do that first because your doctor knows you best. And then your doctor can talk with you about your symptoms, and even if you're not having symptoms, but you think you've had an exposure. And from that point can help you determine if you need to be tested or not. And I would say the majority, well, pretty much I think the providers here in Warren County are all testing. So you can get tested. If you have difficulty getting tested, you can call us at the health department, and we've helped navigate people to testing. So our testing has been restricted based on the fact that we get our tests from the state lab. But even recently with that, we are now able to test people who have symptoms but don't have insurance. So I do want to put that
tested,
out.
how long does it take for you to get information back, whether you're positive or negative?
Okay. Well, that depends on which lab receives your test. So normally, it can take 2 to 3 days on average. If it's a rapid test where the lab reports overnight, you can get it as early as 24 hours. So it really just depends on the lab.
And let me ask you this: upon finding out maybe that you are positive, of course, I hope I'm right, but are we still at a point as where there is no cure as of yet? Are we still there?
Right, we are still at that point. So currently, we do not have a vaccine.
Okay, that's what I'm saying.
Yeah, we do not have a vaccine for COVID-19. So I would say 2 things. One is if you get tested, you should go home. You should not be out in the public until you get your results back. Okay, and you would be advised of that once you take your test. So you should, just be home, isolate yourself, because one, you could not have symptoms and still be able to transmit.
Right.
So please go home and don't be out in the public. And I would also say isolate yourselves from the people in your household because you don't want to infect them as well. And I think that it's really important for people to do that because once you get tested, it's not like you can just continue activities as usual. You really should self-isolate yourself at home and wait until you get your results back so you know what your next step should be.
How do we deal with this thing knowing that, I think I've heard as well, one day you can test positive, or you can test negative one day and positive the next day. How do we deal with that,
Right. So the incubation period for the virus is 2 to 14 days. And in those 2 to 14 days, you can have any of those symptoms that I mentioned, or you could not have any symptoms. And so that's why we ask people to self-isolate at home. And then you will also be monitored and we ask you to self-monitor as well as the health department also calls individuals to monitor them to see how they're doing, if they have symptoms. If they don't have symptoms, if their condition has progressed to where they now are exhibiting symptoms. So I will say, if the health department calls you, please answer. We need you to answer because this is a communicable disease and we are required by law to follow up on cases. So when we call you, we're not trying to nag you. We want to make sure you're okay and we want to make sure the people in your household are okay. But if you are called as a close contact, you will be asked to quarantine at home for 14 days. And during that 14-day period, we will be checking on you to see if you're having symptoms, and if you have symptoms, if your symptoms are getting worse, or if you're, getting better, all those types of things. So we need people to understand that you do need to quarantine if you are asked to do so. Because if you don't, then you're not only putting your household members at risk, but anybody that you interact with in the public, you are also putting them at risk as well.
Services, people, maybe someone, I read something, I think when this first started, as far as people were concerned about going to grocery stores and things of this nature, because maybe there might be somebody in there who may have this virus. How do we deal with it? How does it affect services, things that people touch? Say you go to the grocery store, people picking up vegetables and stuff like that, they may have. What do you suggest as far as?
Well, I think initially the CDC had said that we need to continue to disinfect and clean surfaces, and particularly high-touch surfaces, because that was believed to be one of the primary means of transmission.
Okay.
So now we know from the CDC that that is not one of the primary means. But I will say that we still need to disinfect. We need to practice those hygiene activities in our home and also in our workplaces as well. So it is important. I would also say, like, if you go to the grocery store, I know people like to touch things, but don't touch things you're not going to purchase.
Okay.
So if you're going to, buy some apples or whatever, buy whatever you pick up, and just try to limit your touch. I know some people like to wear gloves, and that's fine as well, but we have to realize that when we wear gloves, and when we move from one surface to another, we're transmitting germs. So gloves are a means of cross-contamination if you don't use them properly. But to use them properly means that you, say for example, I go to the store and I want to purchase some gas. I put on my gloves. First I wash my hands. If I do not do that, I use a hand sanitizer. I put my gloves on. I pump my gas. I put the gas tank pump back. I take off my gloves. I put it in the garbage can.
Thank you for that.
And then I get in the car, I put my hand sanitizer on, and I clean my hands. Okay, so when we use personal protective equipment, which is what that is called, along with the mask, PPE, then we have to make sure we do it the right way. And even things such as how we put on our mask, how we wear our mask. If we wear a mask, it should cover our nose, our mouth, and chin. Okay, so not wearing our mask underneath our nose or under our chin, hanging off our ear, those types of things are not appropriate wearing of a mask or a face covering. So those types of things we have to be aware of, because if you wear them and you're not wearing them correctly, then you're still not protecting others.
What's the best kind of mask? I see a lot of different masks out here. What would you suggest? Is there any different type? One that maybe works better than the other?
Well, I think for the general public, while we're out, we can just wear a face covering. Okay, so, and that's just, you can buy those, or you can make them at home. You can wear a bandana, wear a scarf, as long as your nose and mouth and chin are covered. So you don't have to go out and purchase a mask. You can wear a face covering, and that is actually what the CDC recommends.
Just sort of maybe off to the left. Where do you? I read something the other day that we possibly could be in for a second wave, maybe around during August. Do you have any information on? Do you have any information on that? Not to alert anybody, but just for conversation.
Sure. That's true. Well, I think the state is looking at the data for that for now. I think people are just trying to see how the disease is progressing and then making decisions from that. So I think it could be seasonal like the flu.
You think so?
It just depends.
Oh, wow.
And so that's why they're tracking it now to see how our case counts are going, if we're seeing peaks in the cases or we're seeing trends where we're having decline. So I think, just to be clear, that the virus will be with us for a while.
think so.
So I don't think it's going to go away,
It's disappeared.
particularly until we have a vaccine.
Right.
So I think it's going to be with us for the long haul, and we just need to continue to practice those strategies and follow guidance as it comes out from the CDC. I think there's a lot that we know about the virus, but there are still many unknowns that, we're still learning from people as we learn about all the cases that we have.
I know in the beginning, and this is something that I know in the beginning of this, when you guys first came, we were like doing, we were doing very well. We were flattening that curve, man. We were like on point. But then it seemed like just, I don't know. Do you have any idea what happened? Is maybe because there's more testing. I think maybe you
Right.
said that in the beginning. Maybe we hadn't flattened the curve. We just didn't have the tests going.
Right.
But how can we? And you possibly have said that already. But how can we get back there as far as getting those cases down? Just
Okay. Well, first I would say that Warren County, we kind of started off slow. So
Yeah, we did.
our neighboring counties were ramping up. They were having more cases.
Okay.
We only had our first case on April 3rd. That was our very first COVID case. And even from that, it was very slow progressing till we started seeing an uptick in cases. So now we are seeing more cases. I think some of that is due to the fact that we are doing more testing. We know that more residents are getting tested. And I'll just give you an example. So for the 144 cases that we have that are confirmed, we have probably contacted over 600 people through contact and tracing. So that lets you know how easy it is for the virus to be transmitted. So you go from one case to now 144, now reaching well over 600 people who were contacts of folks who have tested positive. So it lets us know that the virus can spread at an alarming rate, and that transmission can occur easily. So while the governor has put us in the safer at home order, I think people need to pay attention to safer at home because we are safer at home, particularly for those vulnerable populations. So I think for us, part of it is the testing, but part of it is things are opening up and people are feeling more comfortable going out, going to family gatherings and those types of things. And we really have to be careful about those. So while we say we're not telling people not to gather, we're asking people to be safe when they do it. And
where
so
are we
that's
at
where
on the
those-
number now as far as gathering is concerned? Where are we? What is the number now? Is it, as far as the number?
It's, according to the governor's executive order, for indoor spaces is 10 people. For outdoor events is 25. Okay, so that's the minimum that the executive order requires. But we know that there have been instances where we've had more than 25 people at an outdoor gathering, those types of things. So we do ask people just to try to be safe, because it is important.
I read something as well. It's not only is it being spread just maybe within the community, but it's also being spread. I think it says something about as far as the highway is concerned. People have started to move about up and down, the highways that maybe have begun to travel more, and it's also causing an uptick in several cases in different states.
Right. And I think people are traveling more, and so when we try to assess where people are in their symptoms, that is something for people to think about. If you're traveling to an area that you know is high risk, then that increases your risk of exposure. And so we need to be mindful of that, even as we travel.
Okay, thank you very much. Anything, County Manager?
Well, just to wrap up, I really want to have the community feel comfortable and confident that we have county staff. Dr. Brake is an excellent example of that. If you've heard her today, then I think we should be proud to know that we have that expertise here in the county.
Very.
And also her staff. She has a staff of health department employees and nurses who really have been on the front line of trying to make sure we're keeping our residents safe. So I really wanted to say thank you to her and her team, and for them to keep up the excellent work they've been doing.
Thank you very much.
Thank you.
How can they get in contact with you?
Okay, they can call the health department at 257-1185. We also, on our social media pages, both for the health department and the county, We give daily updates on the case counts for Warren County. But I would say if you have any questions, to please give us a call. That information is also available on our county website as well as health department website. But please feel free to call us at any time if you have questions.
Thank you, Dr. Bray. I
Thank
told you guys, she's got a deep well of information, man. I tell you, man. I want to thank you for coming aboard and sort of, giving us an update. You've given us a lot of information this morning that, that we can use. Some we did know, some we didn't know. And I'm also County Manager Vincent Jones. Want to thank you as well for coming.
Wow.
And as always, our doors are always. Any last one? I'll give you the floor for the last words this morning. Anything else you would like to share with us?
No, I just again want to thank everyone for what they're doing to try to stay safe and just remind everybody of the 3 W's and to wear, wait, and wash.
Thank you very much. And of course, our doors are always open for you to come back again. All right.
Absolutely.
Great. Thank you
guys.
so much for having us.
Anytime.
Okay.